Hi friends, I just wanted to come on and say thank you so much for all of your love and support on the video that I shared yesterday. It's honestly overwhelming the amount of comments and messages that I've received. And I've literally received thousands of comments at this point, so there's no way I've been able to respond to them all. So if I haven't gotten back to you, I'm sorry, but it's just not physically possible. But I am extremely grateful for all the support, but I have had a number of questions, and so I thought I would do a follow-up video. I also realized I made an error in yesterday's video. The situation's actually even worse than I described. So just to summarize, in case you missed the video from yesterday, I'm a physician in Calgary, Canada, and the video was talking about the devastating state of Canadian healthcare, and also the fact that in Alberta, the province where I work, the government is talking about cutting physician funding even more. And in particular, they're talking about cutting our on-call stipends and either decreasing them or just cutting them altogether. And now one of the areas of confusion and one of the questions I've got a lot of is whether or not the on-call stipend is the only money that we make on call. And we don't. We get paid for seeing consults, but there are a lot of things that we are required to do or do on call that we cannot get paid for. So the stipend is basically to help reimburse for that extra work that we're doing, also for providing the 24/7 coverage. And also because when we're on call, we have to cancel our regular clinic, so our normal ways of making income are gone for those days. And now, in terms of how much money we make on call, this is where I made an error yesterday. I said that we make $20 an hour to be on call. It's actually only $11.50. I can share a table here that shows the different levels of reimbursement for call, but yes, it's $11.50 per hour. Right now it's for 24/7. However, with the new proposal from the government, they're going to change it so that instead of making the $11.50 for the 24 hours that we're on call, it's only for 14 hours instead. And in the cases of some specialties, they will lose their funding altogether. Now, in the case of rheumatology, for example, like the services that we provide in Calgary, it's actually even less than $11.50 because there are two of us on call at the same time, one for inpatient rheumatology and one for outpatient rheumatology. And that $11.50 has to be divided by the two of us. So we're actually making $5.75 an hour. And because so many of you wanted to know how we make our money on call and what other money we make, I just thought I would give you a couple examples of things we can actually make money for doing on call and things that we don't get paid to do. For example, as a rheumatologist in Calgary, we are required to cover after hours all of the urgent or critical labs for all of the rheumatology patients in the city. And let me give you an example of what this means. So it's 2 a.m. The lab has run some blood work. They get a critical result back. Now, this is not a patient of mine, for example, if I'm on call, but I'm the on-call rheumatologist. So I get a page at 2 a.m. from the lab saying there is a critical result. I get out of bed, call them back. I found out what the result is. I find out who the patient is. And then I log into my EMR. I figure out